An amiable welcome to everyone. This is our Allied Lecdem channel to enhance your understanding. Today's topic is about cardiac anatomy of left atrium and ventricle. Left atrium. Before going into the topic, just take a look of our previous video about right atrium and right ventricle for better understanding. Continuation. The right-sided heart receives deoxygenated blood and sends them for oxygenation via pulmonary artery. After oxygenation, the blood is collected by four pulmonary veins and they drain the oxygenated blood into left atrium. Anatomically, left atrium forms the posterior border of the heart. External features of left atrium. It creates the greater part, that is, two-thirds of the base of the heart. Anteriorly, the left atrium cannot be seen. The only portion called left auricle or left atrial appendage overlapping the root of the pulmonary trunk is seen. Posteriorly, behind the left atrium is located the ascending aorta and pulmonary trunk. And in front of left atrium there is the descending aorta and esophagus. Refer with the picture. Internal features of left atrium. The anterior wall. The anterior wall of left atrium is mainly comprises of interatrial septum. The interatrial septum is formed by septum secundum and septum primum of embryological stage. The closure of septum secundum results in fossa ovalis in right atrium, whereas the closure of septum primum results in fossa lunata in left atrium. Posterior wall mainly comprises of openings of four pulmonary veins, namely left superior pulmonary vein, otherwise called as left upper pulmonary vein, left inferior pulmonary vein, otherwise called as left lower pulmonary vein. Similarly, right superior or upper pulmonary vein, right inferior or lower pulmonary vein. Left auricle. Just like left atrium, the left auricle is also a rough part due to the presence of pectinate muscle. In case of atrial fibrillation or any other atrial pathology, the auricle or the left atrial appendage is the portion which gets clotted. Coumadin ridge. In the first picture, you can see the Coumadin ridge. This ridge is present between left-sided pulmonary vein ostia and orifice of left atrial appendage. Coumadin ridge is the specific site for atrial fibrillation. The name Coumadin or warfarin ridge is given to this ridge because it was commonly misdiagnosed as the thrombus in echocardiography. Blood supply. Atrium is thin-walled and it is supplied by left circumflex artery and its branches. Venous drainage. The deoxygenated blood from the left atrium is collected by great cardiac veins, oblique veins or otherwise called as vein of Marshall, tiny myocardial Tibetan veins. They drain into coronary sinus. Left ventricle. The left ventricle is thick-walled and it is 3 times thicker than right ventricle to withhold the 5 times stronger pressure. Anatomically, the left ventricle forms the apex of the heart as well as the left and diaphragmatic borders. The main function of left ventricle is it ejects into systemic circuit. Internal features of left ventricle. The left ventricle is split into two parts, lower rough inflowing part and upper smooth outflowing part. The rough part is due to the presence of a muscle called trabeculae carne. The inflowing part also comprises of two papillary muscles which attach to the cusp of mitral valve. This portion is a derivative of primitive ventricle of heart tube in embryological stage. The smooth outflowing part, also called as aortic vestibule or LVOT, left ventricle outflow tract, lies between the membranous part of interventricular septum and anterior cusp of mitral valve. It is a derivative of embryonic bulbus cordis. The first picture shows the inflowing part of left ventricle with trabeculae carneae. The outflow part is smooth and lacks trabeculae carneae. Orifice of left ventricle. There are two openings in the left ventricle. The one is left atrioventricular orifice guarded by mitral valve, aortic orifice guarded by aortic valve. Mitral valve which present in left atrioventricular orifice. The term mitral valve derived from the word mitre means bishop hat. In the bishop hat you can see two edges. Just like in mitral valve it has two cusps or leaflet, namely anterior cusp, posterior cusp. Hence it is also called bicuspid valve. The first picture shows us the location of mitral valve between the left atrium and left ventricle. The left atrioventricular orifice guards the mitral valve. The second picture shows us about the mitral valve anatomy. As I said before, mitral valve has two leaflets, anterior and posterior leaflet. Each leaflet have three scallops. The anterior leaflet have A1, A2 and A3 scallop, whereas the posterior leaflet have P1, P2 and P3 scallop. Chordae tendineae. It is a fibrous ring which attaches to the cusp of mitral valve and insert into the papillary muscle. This helps in opening and closure of mitral valve. The green portion in the picture is the chordae tendineae. Papillary muscle. As the mitral valve have two cusps, namely anterior and posterior cusp, there is two papillary muscle called anterolateral and posteromedial papillary muscle. The anterolateral papillary muscle is larger than posterior medial muscle and attached to the chordae tendineae. Aortic valve guards an aortic orifice. It is a semilunar valve that allows blood to exit the left ventricle. It opens during systole and closes during diastole. In the picture, you can see the aortic valve as inverted Benz symbol, and there is a three cusp, namely right, left and posterior cusp. The posterior cusp is also called as non-coronary cusp. Aortic sinus. The ascending aorta is mildly dilated, forming the aortic sinus. There are three aortic sinus, namely left aortic sinus, which gave rise to left coronary artery, right aortic sinus, which gave rise to right coronary artery, posterior aortic sinus. This sinus does not give rise to any vessel and termed as non-coronary sinus. Blood supply. The left ventricle is mainly supplied by left coronary artery. This artery bifurcates into left anterior descending artery and left circumflex artery. Venous drainage. The deoxygenated blood from the left ventricle is collected by great and middle cardiac vein and posterior vein. The collected deoxygenated blood drains into the coronary sinus. The tiny myocardial Tibetan veins also drains the deoxygenated blood and drain directly into the left ventricle. Conclusion. The left ventricle functions by collecting the oxygenated blood flows into it from left atrium. It then contracts and propels to expel the accumulated blood into the peripheral tissue using major vessel called aorta to carry it to extremities. Thank you.